Hi, I'm Dr. Rahul. Today we'll be doing a shoulder examination, and we are very glad that we have Mr. Aul here to assist us. I will just wash my hand with the alcohol. Hello, Mr. Aul. I'm Dr. Rahul, so I'll be examining your shoulder.
Sure.
So is it okay for you?
Sure, okay.
Thanks. And you have any pain in any part of the body?
No.
Any shoulder pain?
No.
Right. So if you have any discomfort, please let me know about it. First of all, we need to inspect the shoulder joint. We need to inspect it from front, from side, and from back. So when looking from the front, we need to check the muscle bulk, the pectoralis muscle, and deltoid muscle as well. Then we need to see the joint line here. This is sternum, this is clavicle, so this is sternoclavicular joint. We move laterally, this is clavicle, and this is acromioclavicular joint, and just below the acromioclavicular joint here is a glenohumeral joint. Then you move lateral, there is this is acromion, and this is coracoid process. Could you just look at that side? Now from the side, you see this deltoid muscle over here, and we need to check for any obvious deformity of this joint here and wasting of this muscle. And we also need to check the neck for any stooping. Could you just look at your back? Now he has some plaster over here, which means that he may have pain in anywhere. Do you have any pain anywhere now? Okay. Now from the back, you need to check the joint line, posterior joint line of the scapula, of the glenohumeral joint over here, and this is spine of the scapula, and over here is a vertebra. So you need to check any deformity of this vertebra and any skin condition, any surgical scar, or any redness over the joint line. Now you also need to check for this muscle wasting over here, supraspinatus, and this is infraspinatus muscle for any obvious wasting of this muscle. Now could I just ask you to press against the wall? And by this you need to check the winging of the scapula, because this winging of the scapula will suggest any serratus anterior muscle paralysis. Okay, thank you. Now you have to feel this muscle and the joint line now. So start from, this is a sternum and this is clavicle, so this is sternoclavicular joint. What you need to feel the temperature over this joint, and you need to compare on both sides, and any tenderness or any deformity of this joint. So we move just laterally over the clavicle. You let me know if you have any pain in any of this joint, okay? So any tenderness over the clavicle may suggest any fracture. We go to the lateral side. This is AC joint or acromioclavicular joint. Now we have to move laterally. This is coracoid process, and we also have to feel the acromial process over here. And this glenohumeral joint, anterior joint line is over the here. So to feel it better, we need to just hyperextend the joint and feel this glenohumeral joint for same thing for any raised temperature, tenderness, or any deformity. And you can just compare over both sides to the glenohumeral joint for the temperature change. And lastly, you need to feel this muscle bulk and any tenderness over the muscle. Could you just turn to that side? Now from the side, you need to check you need to feel the deltoid muscle over here for any obvious tenderness, and just side of this acromial process, there is subacromial bursa. To feel this, you just need to bring out the arm and feel over here in the subacromial bursa for any obvious tenderness. Okay, could you just look at your back now? From the back, we need to feel the posterior joint line of this glenohumeral joint just below the coracoid here. And then we need to move medially along the spine of the scapulae, and then go down over the blade of the scapula. We need to notice any tenderness over this line. Now we need to feel this cervical vertebra for any pain or tenderness, or any raised temperature, or any localized swelling of this region. Now we need to feel this muscle for any obvious tenderness or for the muscle bulk. This is supraspinatus, this is infraspinatus. Thank you. Now we will be doing the active movement of the joint. First of all, may I ask you to put your arm behind your head like this? Okay, bring it down. Now bring your arm behind, in between the shoulder blade as far as you can. The usual range of movement should be the lower border of the scapula. Okay, thank you. Right. Now we will be doing the extension and flexion of the shoulder joint. So could you just do like this for me? Bring your arm up as far as you can. This is the flexion, and then bring it down and bring it back as far as you can. This is the extension of the shoulder joint. Now bring it down again. You should compare on both sides this movement, this flexion and extension. Now we will be doing the external rotation. Could you just do like this for me? And you need to bring your arm outside like this. So this is the external rotation. Okay, thank you. Now we will be doing the internal rotation. Could you just turn to your back now? Now we will be doing the internal rotation. Can you just bring your right arm back and bring it up as far as you can between your shoulder blade? Okay. Okay, thank you. Bring it down. Now we'll be doing the abduction. So can you just bring your arm back of your body like this and bring it up as far as you can and bring it down. During this abduction, you need to check the movement of the scapula for the smoothness of this movement of the scapula during the last range of movement of this abduction. Now we will be doing the passive movement of the shoulder joint. First of all, I need to move your joint, and don't move your joint by yourself. I will be moving. If you have any pain, please let me know. Okay, so this is the flexion. Now we'll be doing extension. You need to feel for any crepitus over the joint. And can you do like this for again? Don't bring it out. So I'll be moving it outside like this. This is the external rotation. Okay, thank you. Bring it down. Now we'll be doing the abduction of the shoulder passively. Don't move your arm. I will be doing for you. You need to feel for any obvious tenderness over here or any crepitus of the joint. Now can you just bring it down for me? Any tenderness between 120 degree to 60 degree is called impingement syndrome. Okay, thank you, Mr. All. We have come to the end of today's shoulder examination. Thank you.